Hello friends, myself Dr. Sonu Panwar, and today I'm here just to tell you a recall of the questions which are being asked for the microbiology, infectious disease and related ones. Also I've covered up somewhat, not all. Okay, the thing is today a lot of questions have come from microbiology, infectious diseases, and I'm very happy to tell you that most of the questions were from the notes and the videos. So a very best of luck to every student who have appeared today and desirous of having a very good rank. So guys, let's start up first of all with the questions, because this is not a detailed discussion. I will be having a detailed discussion later in the app or other video I will make. This is just to tell you the answers and all. Okay, what is the probable answer, and you can put your configuration of the question in the comment section, that this was there, that was not there. So that will help me to rebuild the questions properly. Okay, so I'm already telling up this is not the final version of the questions. So guys, there is there 23-year-old female primary gravida whose school-going cousin staying in the same house contracted varicella infection. The patient reported to the medical center. Testing of the varicella antibody comes out to be a negative one. It shows what? So guys, basically you should know that varicella is the name of the HHV3, human herpes virus 3. Okay, and the primary infection done by this particular virus is chickenpox, and the reactivation is termed as what? Reactivation is termed as herpes zoster or shingles. So obviously the varicella antibody negative is coming off, so she is very much susceptible to what? Chickenpox, as per this version of the question. Okay, and if you have any change in this, then we can discuss. Fine. So reactivation is termed as herpes zoster shingles. Otherwise, this is a susceptibility to chickenpox, which is likely to be answered in this particular question. Then the second question is being asked as one biochemical test was asked, and I don't know, it was a mixture with some pseudomonas and all that. But if this particular picture is being given off, I have already if you see my image-based section in the app, I have done this, and even in my YouTube channel also I have discussed up in 20-minute spectrology video this particular picture, and there is a change in white to blue in this oxidase test, and this oxidase positivity is important. This particular oxidase positivity is important for what? It is important for pseudomonas, and I have told you this will be asked in the exam, and here it is guys. Okay, if you see my live class and all, I used to tell up that this particular thing will be asked, and today it is being asked. Why I have told up this will be asked? Because guys, you know one thing, that this Enterobacteriaceae family is oxidase and catalase both positive. Sorry, Enterobacteriaceae family is catalase positive, oxidase negative. Fine, but a simple test, that is the oxidase positivity, which is present in pseudomonas, differentiated completely from the Enterobacteriaceae family, because that was catalase positive, oxidase negative, and this test is positive in whom? Pseudomonas, and it's a common you isolate in the microbiology lab, so you try to differentiate it up. So this is what is the logic, that that's why this test is important, and that's why I was telling up this might come, and the change is what? Change is white to blue, this particular one. Okay, and I don't know, it was with the burn patient, that was the same question, or burn patient was a different question. You can tell me in the comment section. Now there was a swelling on the scalp with pus filled lesion. Okay, this is lesion, only one, and lesion is red, and there is a dog contact history in this particular one. Okay, and the options of folliculitis, abscess, chorion and epidermal cyst. So guys, this particular thing, dog contact history, this suggests that they are talking about a zoophilic infection, a zoophilic dermatophyte, and zoophilic dermatophyte causes this particular ailment that is termed as chorion. I suppose there was a picture of it, and in my app also I've discussed that the chorion is a painful boggy swelling done by what? It is done by this Trichophyton verrucosum and Trichophyton mentigrophytes, and you know that both of them, they are what? They are zoophilic. Okay, and zoophilic means dog. Okay, so answer to our question is chorion here. Which chemical is used? Which chemical is about leptospirosis? I have taken up those languages only which you have put up in the in the comment sections. So which chemical is used for the leptospirosis along with the doxycycline? So I suppose this was somewhere the question, and the zinc phosphide is the chemical which is used to kill the rats You know that leptospirosis is associated with rat, rice and rain. Okay, and basically the epidemic was there of a sort after the rains in the Kerala, and along with the doxy you can give this particular chemical to kill the rats. I suppose this was a question, and this is what is the answer is, and you can tell me the other options also. Thank you. The patients with urticaria on steroid therapy developed, and the ball is done, and the larvae are seen in that bronchoalveolar lavage fluid. Okay, what is that parasite? The answer to this question is, guys, Strongyloides stercoralis. And you know that this used to cause infections in the immunocompromised individuals, and this is a sort of immunocompromised individuals on a chronic steroid therapy that fellow was. And one thing, if you know that it used to do what? It used to do larvae currents. Okay, and larvae currents is which type of lesion? It's a cutaneous larvae migrans. You know that. Okay, and why it is termed as different from cutaneous larvae migrans? Because the larvae moves faster under the skin. So that's why this is what is the answer, Strongyloides stercoralis. Okay, stercoralis, this is what is there. And basically, I suppose if that this is what is the real question is, the answer to R will be this Strongyloides stercoralis. Okay. And regarding it, you know all those things, it's the OV, paras, parthenogenetic one, common in HIV, causes hyperinfection syndrome, all that stuff. Okay, so basically the answer is that. Then there was a question regarding the friends at a late night dinner party. One started to vomit, followed by another in the morning. Two of them had pastries. And I suppose the virotoxins of E. coli was discussed of Bacillus cereus and Staph aureus. So guys, they said like 2 individuals only they had pastry, and they only had started vomiting and all. So pastry and vomiting associates with Staph aureus. But you can reason up here that the incubation period is long. But it is being clearly written in Harrison that as such incubation period is 1 to 6 hours, but it can extend up to 12 hours. Okay, so the answer to our question is Staph aureus, and you can add upon to this that what else is there, we can discuss that. Okay. Now there was a case, pediatric case with abdominal pain, blood and stool, which enrichment is used for that. This has already been discussed in the app also, in the notes also. The selenite type broth is a enrichment media for both Salmonella as well as Shigella, and this is abdominal pain and blood in the stool, that is dysentery. These episodes are there, and obviously we are talking about what? We are talking about the bacillary dysentery done by what? Done by this. That is the Shigella. This is a typical case of Shigellosis, and obviously you know that the enrichment media is what? That is the selenite type broth for it. Now, there was a question regarding the paronychia of the little finger leading to the lymphangitis in the forearm, and treatment of choice was asked. The answer to this question, guys, is amoxiclav. Okay, and why this is the answer and what they are talking about? You know the paronychia is what? It is adjacent to the to the nail, the tissues that gets inflamed up, and later on this can lead to what? Lymphangitis. Okay, you can have the streaks here, erythematous streaks, lymphangitis, and the only thing which you need to know here is that this is commonly being done by group A strepto, and group A strepto is Streptococcus pyogenes. Okay, Streptococcus pyogenes, and the drug of choice for that is amoxi or amoxiclav. Okay, so basically the answer is this in this particular one. Fine, and I suppose the picture was there, and this is what is the picture for it, as you can see in this particular one. Now, there was a question regarding the standard agglutination test for brucella that have come negative on at the first go. It have come negative, and on dilution it have come positive. The phenomena responsible is. So answer to this particular question is guys, prozone phenomena. And you know what is prozone? Prozone is this is again it is there in my app. It is antibody axis, and prozone is antigen axis. Okay, the antibody axis is prozone and prozone is antigen axis. So basically what happens is by dilution you can remove this particular phenomena of prozone, and that's why it have come positive after dilution. So this is what is there, and you know that this is the best serological test which you can do for this particular brucellosis, and the phenomena responsible is what? Prozone. That is the antibody axis, and how you can remove this phenomena, prozone, by dilution. Okay. And the same thing is going for this particular one also, that is the typhoid fever. In that also you go for this prozone stuff. Now there was a question regarding the hair perforation test positivity, or it is also termed as wedge perforation test. Again, if you see my notes and app, it is discussed. And I suppose along with that there was like white powdery colonies also in this particular one. So our answer is what, guys? Trichophyton mentigrophytes, because in this hair perforation test comes out to be positive. And along with that, if somebody asks you that which other is there in which it comes positive, is Microsporum canis. Okay, Microsporum canis is the one in which this particular hair perforation test is positive. And actually, what is hair perforation test? What you do in this is, like, suppose some infected hair is there, you just put that particular hair into a moist condition, and when you see it under the microscope after 2 to 3 days, what you see a wedge in that particular one, like that. And this particular wedge formation is termed as what? Hair perforation test. And this is basically done to differentiate between two particular individuals. One is Trichophyton mentigrophytes and rubrum. This particular test is negative in the rubrum and it is positive in the case of mentigrophytes. So that was there. Okay. And one extra thing, the urease positivity is also there in the mentigrophytes. So urease positive in hair perforation test, both are positive in whom? Trichophyton mentigrophytes. And if they want to ask up one more, that is the Microsporum canis. This also is hair perforation test positive. Okay. Now, there was a question regarding the fever, hepatosplenomegaly from an endemic visit, and somebody was saying it was from Uttar Pradesh, somebody was saying from Bihar, and there was a picture given up of the macrophage with the kinetoplast, and you know the macrophage with kinetoplast is typical of what? LD bodies. And what is LD? LD is Leishman-Donovan bodies. It is the amastigot form of it, which is found in the humans, and the infective form is what, guys? That is a promastigot. And the vector was asked, and I suppose the scientific name was asked, that is the phlebotomys. Okay, that is the sandfly. The other name is what? That is the sandfly of phlebotomys. And regarding the sleeping sickness, you should need to know that that is the CC fly. Okay, and the infective form there is metacyclic tripomastigot. Okay, so that is there. So most likely this was asked. You can add upon to this. Now there was some whitish discharge from the penis, and men had the unprotected sex 1 week ago. The most common causative organism, I suppose, is clearly gono, because mucopurulent discharge comes out, and the males, they mostly develop what? That is the urethritis, female cervicitis, and a newborn in that particular pregnant lady would have cervicitis, can develop ophthalmia neonatorum. That you know already. Incubation period is around 2 to 7 days, so that is very much covering in that. So answer to that particular question is gono. Okay. Now there was they have given up the features of measles, like regarding the conjunctivitis, fever. Okay, I suppose this was the same question in which they have given up to the 4th day that fever is there. Okay, and they have talked about the complex spot also, that bluish white spot that is present on the buccal mucosa. So obviously they are talking about what? Measles. And they have asked in this twisted fashion, which I was used to tell you that they can ask in this particular one. So guys, this is for those who are giving up the next. This is the way the questions will be asked in the future. As according to the microbiology, they will not be asking you directly that measles virus does measles. Everybody knows that this is measles. But what they have done now, they have changed it into the which particular thing it is. Is it a RNA virus? Is it a DNA virus? Enveloped or non-enveloped? So if you are a follower of my app or my YouTube channel, so you definitely be knowing up that I have discussed of the mnemonic also for this, that the non-enveloped DNA viruses, they are PAP, and non-enveloped RNA viruses, they are PARC. And in the PARC, their families are there: Picornaviridi, Astroviridi, Rioviridi, and Calciviridi. Okay, and obviously it does not come in any of them. And it is RNA virus, and RNA viruses are mostly single stranded, so it is a single stranded RNA and it is an enveloped virus. Okay, so here only I ask you one question: tell me, enveloped viruses are more resistant or non-enveloped? Answer is other one. Non-enveloped viruses are more resistant than the enveloped viruses. Okay, so guys, this is the way to go. You can't remember everything. So how to remember it? You remember like this, that in the DNA, the PAP, that is the Pavo-adeno-Papua, that is non-enveloped, and in this particular one, that is the PARC, they are non-enveloped, and other than that, everything is what? Everything is enveloped. Simple. Okay. And you know that most of the RNA viruses are single stranded except the Rio, which is a double stranded, and in Rio only the rota comes. Okay. So this is the way how it does. HIV patient, the CD4 count around 50 was given up, and it was asked the most common organism causing the right lower lobe involvement or consolidation. It was given off. You can tell me the exact question. So guys, there might be a twist in this question. At such HIV CD4 count of this, immediately we go to pneumocystis cerevisiae. But I suppose it is not so in this question because it was being given off a right lower lobe consolidation. If this was there, then your answer is pneumonia, that is a pneumococcus, and in fact it is most common cause also of pneumonia in the HIV positive one. And pneumocystis cerevisiae, this is not the pattern of it. Interstitial infiltrates are found in that. Okay, perihilar ones, perihilar opacities are observed up in this particular one. And if we talk about the atypical presentation also of the pneumocystis cerevisiae, upper lobe involvement is written up in the Harrison. So obviously the answer to this question can turn out to be Streptococcus pneumoniae if these all things are given off. You can tell up again regarding this also. Okay, so this is what is the twisting they have done in this. I suppose majority have answered on pneumocystis cerevisiae, but do tell me, I also don't know. So need not to be like this way that I got it wrong and what. You can tell me what was exact one. Okay, because this is recall, guys. So fast we can do the recall also. Now there was a question regarding a patient on multivacillary drug regimen develops a rash. Okay, that fellow developed a rash with elevated margin. Okay, that is that fellow is having macule, papule, nodule and all that stuff. So basically what they want to ask up is that this is the development of what? This is the development of lepra reaction. And this is which type of lepra reaction? It is a type 2 lepra reaction. And type 2 lepra reaction, another name is what? Erythema nodosum leprosum. Okay, and the treatment for both type 1 and type 2 is steroids, and you can continue the MDT with them. The answer is MDT, and you can add the steroid, and you need to add the steroid. Okay, so basically this is what is the answer for this particular question, and you can tell what is exactly was there. Is the same thing was there or something else? So you know that these formation of macules and all is due to tumor necrosis factor alpha. That particular thing is there. Okay, and besides this, in the type 1 lepra reaction, which is termed as downgrading reaction also, in that the most common nerve is ulnar, which is involved up, and there is an edema there, and for both of them you use what? The drug, that is a steroid. Okay, now I suppose this was there, the 36 weeks of gestation, painful blisters in the vulva, that is I suppose HSV lesions, and these were the options. So obviously you will go for acyclovir along with the cesarean section as per me. Okay, other versions can also come, and let's see what all versions they come. I have told up in the class also, in the app also, that it's always better to go for cesarean section if it is around this time. Okay, along with this antiviral drug, that is the acyclovir. Now there was a question which I have discussed up a few days back also in my one of the YouTube channel, like that particular video in the YouTube channel. And Sheath larvae with no nuclei in the tail. Obviously the answer is what? Wuchereria bancrofti. And with this particular thing, we differentiate from whom? We differentiate it from the Brugia malae, because in the Brugia malae we have what? Terminal 2 nuclei. Okay, and if somebody asks you that which all are sheathed, Brugia malae is sheathed, no doubt about that. Okay, in fact the mnemonic for that is low molecular weight. So this particular one, low birth weight. So L is lova, B is Brugia malae, and W is Wuchereria bancrofti. Okay, so these are all they having the sheath, but no nuclei is a feature of which fellow? It is a feature of Wuchereria bancrofti. Okay, again discussed up in the image based section also. Now a ENT correlation, a roomy space with foul smelling, yellow discharging granules, was it there? I don't know. Okay, so answer obviously roomy nose with foul smell, that is the atrophic rhinitis. Immense foul smell comes in this, and anosmia is there in this particular one. Okay, anosmia is there, immense foul smell is there in this particular one, and a characteristic feature, that is the roomy nose, that is feature of this atrophic rhinitis. And can you tell me the bacteria which does it? That is the Klebsiella usini. That particular one leads to usina, and this usina is another name is atrophic rhinitis. Okay. Now, This question, I'm not clear what was exactly there. The painless, non-foul smelling, profuse white discharge per vagina in a female without reaching on 15th day of the cycle. The diagnosis is what? What a, this is a atypical type of question. I don't know what to answer it. And is this was the question or something else is there in the question? You can tell that also. So it sounds that there is no itching. So obviously this is being discarded. With trichomoniasis is having itching stuff, that is strawberry vagina, strawberry cervix. Bacterial vaginosis can have a vital discharge, no doubt about that, and that too without itching is there. But the thing is, it is not non-foul smelling. Candidiasis is having a curdy white discharge. Okay, it's having curdy white discharge, and itching is absent there also, or might be present sometimes. So this question you can tell me, guys, what you have marked and what is the probable question, exact question you can tell me. Okay, so this bacterial vaginosis, Amsel's criteria, trichomoniasis, those particular ones we have discussed, pH more than 4.5, strawberry cervix, that is Colpetis macularis. Okay, and that is greenish white discharge, and sometimes yes, it can be white hair also, but this is itchy. Fine. Bacterial vaginosis, Amsel's criteria, candidiasis, curdy white stuff. This is profuse white discharge. So might be physiological also one of the answers. You can tell me exactly what was the question and what you have marked up. Now this is also one of the questions, like first abortion 6 weeks, second abortion 11 weeks, third is 24 weeks. So there is a gradual increase in this. So these were the options there: TORCH, APLA, FIFLIS, GDM. Okay, because antiphospholipid antibodies, these are also one of the causes of recurrent abortions. TORCH also causes recurrent abortions. Syphilis also associates with recurrent abortions. So all of them are there. You can please tell up in the comment section what is the exact the exact question was what, and what you have marked up as answer. Now there is a child with hydrocephalus underwent the operative correction and later presented with headache and irritability. So somebody have undergone a shunt surgery and after that developed the meningitis. Okay, so obviously what is the next step? So basically you should go for the culture from the CSF shunt only. Okay, and again, this is one of the questions which you can tell up that what was the exact options in this also. The child with hydrocephalus underwent the operative correction, later presented with headache and irritability. Obviously, that is developing up the meningitis and all. So what should be our next step? Next step is obviously lumbar. You can go for the lumbar puncture and you can culture it off. And along with that also, this is also needed up. That this particular shunt culture also should be done. The next step is obviously to diagnose up, and next step is to diagnose up this headache and irritability. So you will go for lumbar puncture, I suppose, and you can tell me what are the other options also here. The best microscope to see the motility of trypanosome pallidum. This is discussed up a number of times. That is the dark ground microscopy. Okay, dark ground microscopy. And can you tell me that which type of light is used in this? Reflected light or transmitted light? The guys, we use reflected light in this particular one. Because of that only the background turns dark, and this is especially used for the spiral fluids. Favorite question, again it have come. Now there was a question regarding the pharyngeal infection somebody was having. The throat swab was taken, and which colored bin this particular swab will be discussed, it will be discarded. The answer is obviously yellow. The microbiological waste goes into yellow. And to answer to this particular question also is what? The yellow only. Then I suppose there was a question regarding the inguinal buboes, and there was some history. You can complete this question, and the vector was asked. So Xenophysilla chiopus, that is the chiopus index, that is the rat flea index which you look out in this particular one, and we are talking about the bubonic plague here, in which this particular presentation is there, inguinal buboes, and you go for a staining here. That is the Western stain, in which you can see a bipolar stain organism, that is the Yersinia pestis, and Chiopus is the index which you look out whenever the epidemic outbreak is there in a particular area. Okay, the drug of choice is streptomycin for it, and culture media is, that is the ghee broth. Okay, then there was a question regarding endemic encephalitis, and according to the universal immunization schedule of the route of administration was asked, I suppose. So answer to that question is the route of administration as per the universal immunization program is subcutaneous one. Okay, so this is being given off in 2 doses. This particular one is there, and obviously this is that Japanese encephalitis, which is endemic up in the eastern UP area like Gorakhpur and all, and you need to give this particular vaccine subcutaneously there. Okay. Now something was there regarding the blood spill, and the blood spill is best managed with. So if this is option, nothing to be observed of. 1% sodium hypochlorite is best. And if somebody asks you which is the first thing to be done in a blood spill, you have to contain the spill. Okay, you have to contain the spill, and then you have to put this 1% sodium hypochlorite over it to disinfect. Now there was a question regarding this also. Child is there having the myoclonic seizures, and because of that there is a recent decline in school activities of that particular individual. There is no past history except for the fever with rash in the first year of life. So guys, here they have asked up in a twisted fashion SSPE, and very clearly written up in the book that in this there is myoclonic seizures. Okay, and mostly it happens after 5 to 15 years of this particular first episode of measles, and mostly it is fatal. If it is not found in the first stage, then definitely it turns out to be fatal. And the diagnosis is mostly made by this IgG serological diagnosis. This is found to be very raised in the CSF, and if this is not able to diagnose it, then you can go for the brain biopsy. Okay, so that is also one of the things by which you can do, and along with that you can go for this also, EEG, to see up the waves and all. Diphasic waves are seen in this particular one. Okay. Now this is a very straightforward question which is being asked. I suppose this was also there. Obligate arrow. If you see my starting video only, must know I have told of Pseudomonas is an obligate arrow. Along with that, Mycobacterium tuberculosis is given up, which is obligate arrow. Obligate arrow means what? Which have an obligation that they need a desperate oxygen, otherwise they will die. Along with that, you can remember up BBM, that is brucella. Okay. And this particular nocardia, brucella, nocardia, these are also there, which are termed to be coming up in this obligate arrow. Fine. So I suppose these were the questions which were asked up in the exam, and obviously there is a lot to be told by you also to complete up some of them. And I suppose my effort of app and my YouTube channel videos definitely have helped you. Now the exam is over. Just chill for some time and analyze your efforts. That now अब तो जो होना है वो हो गया, ठीक है. जैसा होना था हो गया, जो गलती करनी थी कर ली, ठीक है. But overall scenario which is coming out from this particular exam is that this was a bit easy. On the easy side, this particular exam was there. So the cutoff will be high, and but definitely if this particular thing, if somebody have done properly from my notes and all, so obviously that fellow will be having a definite edge. Okay. So guys, this is the way to tackle up these types of subjects, because microbiology is a lot of facts are there. Okay, you can't learn everything, you can't get after everything. Like suppose you see that particular question here today, that was measles question. So if you start learning like this, that this is amulet, this is non-amulet, this is amulet, this is non-amulet, you can't able to. So the way is that you remember the simplest thing, that which are the non-amulet ones. So non-amulet DNA, non-amulet RNA. Okay, you know that non-amulet RNA are there. Okay, then in the same interesting aspect, in the starting I have told her that RNAs are single stranded. RNA viruses are mostly single stranded, and these particular ones, they are only one exception is there, that Rheovidae family, which is double stranded RNA, that in that the rota comes. Okay, in that the rota comes. So that is there. Along with that, this particular mnemonic definitely would have helped you to crack this particular question, that we are talking about a single stranded RNA. Okay, and that particular single stranded RNA is an ambulant one. We are talking about measles there. Okay, and they have given up all the options like of the complex spot and all that stuff. So obviously they are giving up the hints that conjunctivitis is there, coryza is there, fever is there, okay, rash is there. So basically they want to ask up from that particular front only. So I suppose if you adapt up this type of thinking for your future exam, even if it is next and all, so that obviously this have given up like an insight that which sort of questions will be asked up in the next exam. So basically they will relate up like that particular question. If you see that paronychia one and later on that erythematous streaks are there, lymphangitis. So obviously you should know that that particular ailment is most commonly done by group A strepto, that is the streptococcus pyogenes, and the drug of choice for them is amoxicillin or amoxiclav. Okay, so this is the way to go, guys. And if you see the lepra reaction also has been discussed properly. So in total, what I can say that out of these 28 or 30 questions, like 25 easily, if you go by my videos, YouTube channel, like these particular videos or my app videos and along with my notes, these all are easily being done. Okay, and obviously you can definitely tell me those particular questions which I have marked up to complete. Okay, and thank you so much. Very best of luck for your result, and I hope you will all get very wonderful ranks, and definitely you can tell up that which all questions you think were there, and in which you are not agreeing with me that this was there and that is not the answer and all that. So everything is welcome. Okay, this is democracy, not Taliban. Okay, so basically just tell up and just chill for tonight. Okay, see you, bye bye, take care.